Will she get them? Let's ask Wisconsin Democrat Ron Kind. He joins us now from D.C. That's the first question there. Are you going to have the vote this weekend, and are you confident that you'll get enough of the Republican-Democrat regimers on board to vote and get it passed?
Well, hi, guys. Happy hour, by the way. Well, listen, I voted against the legislation when it came out of my Ways and Means Committee because I felt it didn't do enough in cost containment. How do we bring costs down to make health care more affordable for all Americans? And here's the problem as I see it. Today we're spending over $700 to $800 billion every year on tests and procedures that don't work. They don't improve patient care, and because of the over-treatment in too many instances, we're making patients worse off rather than better off. So I was able to get in this legislation a way to change the way we pay for health care, away from the fee-for-service system that we have now, which is all volume-based payments, to a quality or outcome-based payment system. That, I think, is crucial to fundamental reform and how you make health care more affordable for all Americans.
But Representative Kind, what's the rush? Senate's not going to vote on this. Why are we pushing this? What's the urgency to get this done so quickly as opposed to getting it done properly?
Well, I think that's in the eye of the beholder. I mean, you really have to look back to Teddy Roosevelt as the first president who was calling for major health care reform in this country, and that was over 100 years ago. And we've been living and breathing this now for the better part of 10 months, and even way before that. I've been working on payment reform since the very day I joined Congress in the late 1990s. But the status quo is clearly unacceptable, and it's unsustainable. If we do nothing, we know what the consequences of that will be. We will pay more, we will get less, and we will bankrupt ourselves from family to business and public budgets alike. So I don't think doing nothing is a very viable option right now.
Congressman, let's talk about small businesses. You know, we were talking earlier in the show about job creation, this terrible unemployment situation we have in this country. You know, we want to stop relying on the government to be our saving grace, to create jobs for us, to give us unemployment, etc. Okay, so this health care reform, is it going to hurt the small business? Is it going to help the small business? This is the big debate. You know, they're sitting here saying that a business is not going to hire because of what you're doing. Is that true? And if not, explain.
It is a very important issue, and when you look at the 50 million or so uninsured in this country, most of them are working Americans in small businesses or on family farms or individuals who can't go out into the small group market today and find affordable health care. That's why, you know, based on legislation that I've offered in previous years, we're setting up this national purchasing pool for small business to go into. And then through through competition in the marketplace, they'll have a menu of health plan options to choose from with complete transparency, what they're going to get, how much they're going to pay for it, and they will finally have the same type of large group leverage that big companies have when they go out and negotiate rates for their employees. So I think that's an important step, and we're coupling it with tax credits to make it even more affordable for small businesses. But listen, I haven't talked to a small business owner yet who wouldn't want to be able to provide health care coverage for his or her employee. They can't because it's too expensive. I think this national exchange is a way for them to do that.
Representative, we're just about out of time. Any chance that we are going to for sure repeal the exemption to the antitrust laws that the health insurance companies have across this country? I don't want to hear about cross-border, cross-state transfer of these policies. I want antitrust enforced.
Yeah, you know, we are going to be repealing that. That's in the legislation right now. But more importantly, we're going to change the way we pay for health care so that it's value-based, not volume-based. I think that is fundamental and key to reform. And then allow the competition in the marketplace, be able to drive prices down even more. We're going to deal with pre-existing conditions. You know, the ability of insurance companies today to drop people when they do get sick or injured. And there's going to be more emphasis on prevention and wellness, which is long overdue.
Rule of law, guys.
Representative, we'll keep our eye out on all of this. Thank you very much for joining us.